Welcome back to Super Season of Proactive Physio Podcast, episode number 3. I'm your host, Jamie. Today I'm going to talk about predict chronic pain by exploring the brain. In this podcast, I'm going to discuss the relationship between mind and pain also. The mind and pain are closely linked with each other. Pain signal starts in the body, but the brain process these signals and shaping our perception and experience of pain. There are factors like mental state, emotions, belief, and movement patterns. This can significantly affect the pain intensity and duration. By understanding the brain's role in pain perception and changing our belief about it, we can achieve a better pain management and enhance the quality of life for those with chronic pain. Now let's understand about how pain, mind, and movement are connected. Both mental well-being and physical movement are vital in shaping how we experience the pain. Many literature shows that our mental state, beliefs, and movement can greatly influence the pain levels. In fact, pain can fluctuate based on factors which is unrelated to the injury itself. Pain is not just about a tissue damage, it is a complex interplay between the mind and body. We must recognize the brain's central role in pain perception and the importance of movement for recovery, which can transfer how we respond to pain. By addressing our beliefs, emotions, and movement patterns, we can lower pain intensity and improve overall quality of life. And even in this, we can improve in chronic pain also. A modern pain science reveals that pain is a complex and fluctuating sensation which primarily shaped by the brain. It serves as an overprotective warning system with the brain generating pain based on various signals that includes from damaging of the tissue. Our brains can create a pain from minimal stimuli or downplay trauma that seems intensely painful. While they don't always respond this way, it is clear that pain is fundamentally a brain generated experience. Everything we perceive is entirely brain made. So, can we think pain away? What influence does the mind have on our pain perception? Are traits like confidence, optimize, and education as effective as pain reliever like acetaminophen? How do practice like meditation, hypnosis, and cognitive behavior therapy fit into this picture? There are a number of ways that we can understand about the pain also. However, mind, body, and lifestyle medicine primarily focus on addressing the vulnerability that lead to pain. This includes tackling root cause such as severe stress, sleep deprivation, poor nutrition, all of which that can contribute to the painful condition also. So next time when you have a patient with a chronic pain, do consider this factor. Mind over pain and mind body curves have a long captured our attention. Recent research highlights the brain's ability to influence pain, revitalizing old theories about its psychological nature and sparking a new optimize. Yet, there are some leading to false hope also. Many patients believe they can simply will away their discomfort by taking some medication. The key challenge is convincing our brains that there is no real threat. Educating the patients about pain can often help them understand that the dangers associated with chronic pain are frequently overstated. However, explaining pain can be tricky and may come across as suggesting that patients just need a better mindset. Fortunately, there are effective self-help strategies to explore about the pain also. We can educate about pain as well as disregarding alarming diagnostics theory and addressing anxiety and stress that can also help for relieving the pain. By incorporating this approach, patient can take proactive steps towards the managing their pain and enhancing their well-being. On the top of that, we should minimize the excessive focus on pain, the cognitive perspective that also helps for managing the pain. There are many possible meanings of mind over pain, and most of them overlap to some extent with modified perception. If we consider the pain as a mind body experience that is not solely a physical sensation but also an emotional and cognitive experience, also. The brain plays a central role in pain perception and can even generate a pain signals in the absence of tissue damage. Once we understand about the chronic pain, it can be particularly influenced by psychological factors as the brain may learn to amplify pain signals over the time. We have to consider many factors regarding understanding the pain. how the mind affects pain. Let's talk about this. Emotions and anxiety, that is also one of the factor. Negative emotions like fear, anxiety, and stress can intensify pain, according to some literature. Thoughts and beliefs. Our thoughts and beliefs about pain can significantly impact how we experience it. When the patient has a severe low back pain and he has difficulty for the forward bending, he has some negative thought inside her mind that if I'm going for the forward bending, I may have a pain. But on the other side, they can do very easily. So this belief about pain can significantly impact how they experience the pain. Cognitive processing, this is also one of the effects in pain also. The brain interprets pain signals and considering past experience and the context of that situation. On the other side, movement and posture, that is also affect the pain. There are changes in our movement pattern or posture can affect the pain perception. Now let's talk about how pain affects the mind. Previous we discussed about the mind affects pain. Now how pain affects the mind. Mental health, negative thoughts and feelings, and cognitive impairment. These are the three factors can be affected the mind also. When the patient is suffering with the chronic pain, which can lead to a worsened mental health condition like anxiety, depression, and post-traumatic stress. Pain can lead to the downward spiral or negative thought process also, and sometimes feelings of isolation. Pain can affect the attention, concentration, memory, and further impacting mental well-being. Pain, mindfulness, and meditation are interconnected concepts. The mindfulness meditation involves focusing on the present moment without judgment, which can help individuals manage and alleviate the pain. By cultivating awareness and acceptance of pain, meditation, which promotes the relaxation of a skeletal system, and it reduces the emotion and physiological response that amplifies suffering, which providing the effective tools for the pain management. Mindfulness and meditation may not eliminate pain entirely, but they can help you develop a healthier relationship with it and reduce its impact on your daily life. So be open to experimenting with different techniques like breathwork, yoga, or guided meditation to find what works best for your patient. So, in summary, understanding the brain's role in pain and changing beliefs and perception about it, which can lead to the better pain management and improve quality of life for your patients living with persistent pain. Thank you for listening to this podcast. If you like this, please share and subscribe.